Let's talk about panic buying for a minute in the wake of the coronavirus. It is leaving store shelves empty. So what is the reasoning behind it, and why are the stores emptied of toilet paper first? We kind of chuckled at first, but now, a lot of us are trying to find it. Dr. Paul Valbuena is joining us live with us this morning. Doctor, tell me about this panic buying mentality.
Sure. This is really something that's been seen before, even after 9/11, after SARS. You see it a lot even during hurricanes. We are prepared for those things. After earthquakes, there's a surge of buying. Any crisis, people are afraid of not being in control. They're afraid of possibly losing out on something that is essential and easy to get, and it can easily become scarce. So there's this natural behavior of buying unusual large amounts of things that really are just really easy to get typically. So a lot of it's driven by social interaction and how people observe how society is moving. And if they do see an empty shelf of, it could be beef jerky or it could be any item, they'll latch onto it. And it just so happened to be for this one, it's not so much bread and milk, which is typically something that'll go off the shelves prior to an ice storm or a hurricane, but you'll see things now like toilet paper, hand sanitizers, of course. That would be the natural response to this coronavirus.
So, Doc, I got to ask, it's a respiratory virus. Why'd they run to the TP?
Good question. And there's a lot of people that are wondering that. And, there's even been some memes and jokes about how toilet paper is going to help you prevent you from being infected with the coronavirus. But really, I think that's really driven by social interaction, social media. When people see empty shelves of toilet paper, they automatically, as a human response, think that it's going to be a scarce item. These are essentials that we have every day, and sometimes we take it for granted. And the analogy is something like a diamond. A very good cut diamond is rare. And now you're seeing a surge of toilet paper consumption and purchasing, and people assume that it's going to be a rare commodity. And it's really kind of it's a natural behavior, nothing abnormal about it. But, people really need to start looking at how it affects other people, and especially our elderly population who has a difficult time mobilizing.
Yeah, no doubt about it. It seems kind of like self-fulfilling prophecy where, so many people were able to store up, and now those shelves are bare, and it is difficult to find some of those supplies.
Exactly.
So what are you telling people who can't get their hands on those supplies?
Well, what I do tell them is to be definitely educate themselves on reliable news sources. And also, I think, right now it is saturated. The news streams are saturated on every channel, every newspaper. So kind of pick and choose some reliable sources that you do follow. And also, people can get consumed in this daily. It can consume their life currently, how they live, because it is affecting lifestyle right now.
And so since we are talking about psychology right now and the panic buying psychology, we've been cooped up in our houses. Many of us lost our jobs this week. We're stuck with our kids for, we know, at least 2 to 3 more weeks until school may possibly open later in April. What do you want people to do today for their mental health?
Sure. I think people need to make a self-assessment, and even, maybe even ask some of their loved ones that if this stressful, rightfully so stressful time in people's lives right now, if it is affecting their level of functioning, I urge them to seek some help from a mental health professional. We at Valbuena 360 Wellness have a team of physicians and also therapists that can help for some of the extreme cases. But I think for the most part is to not panic. And we have to entrust that we have a good government in place. We have good healthcare providers that are working. They're still employed. They're still dealing with the urgent issues in our life right now. And I think to have a level of trust. So I think mindfulness, some meditation, deep breathing, maybe go out and spend some time on your balcony. I know we're limiting a lot of our social interaction right now, but this is really a time to maybe disconnect a little bit and reconnect with families, people that work every day, people that are consumed with the everyday grind of
Enjoy that
living.
time together,
Yes.
Doc.
Yes,
Thank you so
indeed.
much. We appreciate your time.
Yes, thank you. Take care.